Greetings everyone, I am Maitri Patluri, MPH student at UNF Jacksonville. Today I will be presenting to you a brief guide regarding utilization of social marketing to promote public health. A widely accepted definition of social marketing is the one adapted from the publication below. It defines social marketing as application of commercial marketing technologies to analysis, execution, and evaluation of programs designed to influence voluntary behavior of target audiences in order to improve their personal welfare and that of the society. Please note the underlined words that are key in this definition. Also, it is to be noted that social marketing is a systematic and strategic planning process resulting in an intervention or program. Now that we know what social marketing is, let us see what it is not. Social marketing is not a media campaign, it should not be targeted in reaching everyone, and it is not a fast process. It is most helpful when used from the beginning of the planning phase of the public health initiative, when the target is to cause a voluntary behavior change in the target audience along with raising awareness. The key steps involved in social marketing are the following. First, you have to assess the problem and specify your objective, including a specific measurable behavior. Next is a phase of audience selection, in which the primary target audience and the secondary target audience are selected. Next comes the phase of developing the intervention strategy, considering the cause and barriers to behavior change and promoting the intervention via marketing. The next phases involved are the strategy development, in which a plan specific to the population is developed, and the intervention design, evaluation of the doability of the project, and finally implementation. I'll go over each of these phases in detail, starting with the problem description. First, it is important to obtain information regarding the problem you are addressing. This can be done via literature reviews, epidemiological studies, policy and legislative databases, and healthcare systems. Factors contributing to the problem must also be assessed. For example, unavailability of fresh food in a community and unclean water in the community might actually be the root cause of the disease in that community. As part of the problem description, a measurable objective has to be developed, such as decreasing the number of cigarettes a person smokes by 50% or doubling consumption of fresh fruits in the community. Next to the phase of audience selection. It is key to understand which groups of people need to change their behavior the most. Secondary audiences are the ones who can influence the behavior of the target audience. It's important to realize that social marketing cannot reach everybody and has to be targeted at the people who will benefit most from the intervention. The criteria for selection must include people who are likely and willing to change, who are accessible to study personnel, who have behaviors amenable to change, and availability of methods to measure data before and after intervention. Next, you have to decide which behavior to promote. The barriers for each behavior have to be identified as per the audience. You then have to analyze what the audience thinks about the problem and look for gaps in the knowledge of the audience. Another key aspect is segmenting the audience into homogeneous groups. This can make the message more personal to the audience. Next stage is the stage of strategy development. In this, an attempt has to be made to describe the experience of the audience and a strategy developed accordingly. For example, you need to know where they shop for cigarettes, what are the stresses that might be increasing smoking, and identify any spots in the community where passive smoking is a problem. The incentives, motivators, key influencers, and partner resources to the behavior must be understood. It is always valuable to turn each behavior into a measurable objective. For example, obtaining the number of cigarettes that are sold in the community store or self reported cigarettes smoked per day. Next comes integrating marketing mix into the strategy. Marketing uses the concept of 4 P's, which are product, place, price, and promotion. Product includes what the audience gets, maybe tangible items or intangible benefits such as improved health. Price includes costs or barriers of making the desired change in the behavior. For example, the expense of healthy food may be driving people towards cheap unhealthy food. Place is where audience performs the desired behavior. Promotion includes messages and materials. Next is the phase of design of the intervention. This phase has to be creative, addressing the specific barriers identified. An example of a price related activity may involve reducing the cost of nicotine patches or gums. Place related activity can be exemplified by designating smoke free zones in the community. Promotion related activities may include newspaper articles, radio ads, brochures, or website content. Ideally, each activity should be connected with the overall marketing strategy and the behavioral objectives. Then all the activities have to be coordinated into an integral design. Then the contents of intervention have to be developed, such as wording of the brochures and messages to be sent. The funding for the incentives have to be decided, and responsible personnel have to be designated for every step of the program. These personnel must have to be trained appropriately according to their roles. Developing partnerships and agreements with organizations in the community can be helpful at this stage. Next is the evaluation of the intervention. This has to be performed before, during, and after the completion of the intervention. The 6 steps of evaluation are engaging stakeholders, describing the program, focusing on the evaluation, gathering credible evidence, justifying conclusions, and ensuring use of lessons learned. The final stage is the implementation itself. This depends on the specific marketing strategy that is employed. The program budget has to be monitored and deadlines has to be set for each task and personnel assigned. It's important to remain flexible and make changes to strategy as the program progresses. It's recommended that implementation is done in phases with improvements being performed as you go. Obtaining feedback from the participants and making changes as needed can increase effectiveness of the program. The behavior should be assessed for the sustainability in the long term. In summary, social marketing has great potential in the field of public health. Remember that it attempts to influence voluntary behavior and must be focused on a selected audience. The 4 P's of marketing must be integrated into the intervention. Intervention has to be creatively developed based on the community, and evaluation must be performed continuously. Sustainability of the behavior change must be assessed. Here are my references. Most of these are from the CDC website, which is a great resource that I recommend for anyone looking for more information. Thank you very much.